Bill Koffel, Koffel Associates. I'm President of Koffel Associates.
This morning you talked about one particular item, which was fire protection and sound issues. I know you gave a great presentation. Can you just capture a couple of key items that are most important, maybe 2 or 3 items for someone who wasn't here today?
Well, thank you. Some of the key points in the presentation, I think one would be to properly design the fire alarm system with the facility and the operational considerations, in particular fire emergency considerations, in mind. Secondly, think about the noise, and there are ways to control the amount of noise that might be produced or how frequently it's produced by the fire alarm system. And then lastly, while there are certain things we need to do, obviously we want to minimize any unnecessary alarms within the facility.
And what does your firm do?
We're a fire protection engineering and code consulting firm with our headquarters in Maryland, but we do have an office here in Quincy, Massachusetts.
What's on the horizon for these healthcare engineers? Are there any issues coming up down the road that need to be on their radar screen?
Well, I think the general topic of our talk, and Lynn can go into that in more detail, but their role of how they can help improve a facility's patient satisfaction results, referred to as HCAP surveys. I think that is something that a lot of them should or are currently now getting involved in.
You know, when it comes to surveys, patient surveys, I think the general public thinks of things like food and nursing care. Is it relatively new that facilities can make such an impact in that respect?
I don't know if it's relatively new, but I think the survey results are identifying things that maybe we hadn't thought about before. And if you've ever been in a hospital, and I've been a patient in a hospital for an extended period of time, noise is something that really does start to get to you at some point in time. It's affecting your sleep, it's affecting your ability to maybe concentrate if you're having a discussion with a visitor or guest in your room or something. So I think noise is a top issue, and the surveys are certainly telling us that.
The other thing I've seen in surveys is sometimes it is the person serving the meal, the person cleaning the room, that can make such a distinct impact on patient care. Any comments on that particular?
Absolutely, and Lynn spoke to that. You know, one of the simplest things you can do is to, care for your patients with a smile. I actually know a facility that they refer to all of their staff as caregivers. That's their title. I'm a caregiver. I'm not a nurse or a technician or something. I'm a caregiver.